You're on, sir.
Thank you. Thanks. Good morning, everybody. Thank you, Santa Fe and everywhere for tuning in, listening. This is Mayor Alan Webber from City Hall. I would ordinarily be wearing my mask, but I'm alone in my office at City Hall. There's nobody around, so I'm coming to you unmasked. Before we talk about today's subject, which is COVID, I want to wish everybody happy holidays, Merry Christmas, and a Happy New Year. I hope this season with a little snow last night and this morning is bringing people some joy, a little fun, a little family time, some good food, and a recognition that we are really all going to make it through this together. We're doing well. We've got great people to help us. We're looking after each other as a community can and should. But our subject this morning, and I've got some special guests to carry the message. Our subject is what's going on with COVID in the world and in the country right now, and also here in Santa Fe and New Mexico. And what's going on is a very serious spike because of the Omicron variant. It seems to be easier to spread, faster to spread, perhaps not as dangerous in some respects if you're vaccinated and boosted, but still, we really are seeing the numbers go in the wrong way. And it's a time for us to take a moment to recalibrate, recommit ourselves to doing the common sense, basic things we know will make a difference to stop or reduce the speed and severity of that spread. We're not in March 2020. We know a lot more than we did 2 years ago about what it takes to contain the spread of COVID, to help each other stay safe, to keep our families and our colleagues at work safe. And that is what we're going to talk about for a few minutes this morning. Some level setting, some straight talk, where we are, what we can do, how we go forward. I'm going to introduce now my friend Lillian Montoya, who is the president and CEO of Christus St. Vincent. She has with her two of her colleagues in the hospital work who are able to provide real data and real information about what one of our key providers of healthcare in our region, in our city, what you're seeing, what you're doing, and how we can all take better care of each other. So Lillian, thank you for coming. Thank you to Dr. Ronan, Dr. Marx for being with us. I'm going to turn it over to you, Lillian, to set the stage. What is Christus seeing? What do you think is happening in Santa Fe right now? How can we all take better care of each other and really try to get back to a better condition like we had before this most recent variant arrived? Some straight talk from Christus. Thanks for being here.
Thank you for inviting us, Mr. Mayor. I'm glad that Drs. Ronan and Marx could join us today because I wanted them to share with you from their perspective as well what we're experiencing. But just to give you a sense of our hospital and our clinic activity, we did very definitely see a spike in COVID patients, inpatient admissions, as well as positives about 5 to 7 days post-Thanksgiving. We're now starting to see that effect come down just a bit, but we expect something similar post-Christmas, so in the next few days, and then again after the new year. And it is worrisome because as we looked at the data this morning, well over 80% of our admissions for COVID positive are unvaccinated, like not fully vaccinated or not vaccinated at all. And we are seeing a growing number of those admissions come through the emergency department. Like a lot of the businesses in the community and families, we are seeing more positives generally in the workforce, largely for those same reasons. Because we have well over 95% of our workforce vaccinated, they're largely asymptomatic. They're not feeling the full effects as if they had the virus. So vaccinations matter, getting that booster matters. The other thing though is, our COVID unit, our Frost 19 unit right now, we can care for up to 30 people in that unit. That unit got up to upwards of 32 in the last month. It's now come down to around 20. About 2 months ago, we were hovering in the 12 to 15 range. So it gives you a sense of just how we're seeing those volumes. So we have a combined ICU that's the COVID area ICU as well as general ICU. We've exceeded capacity of 100 to 100 well over 100% capacity inpatient. And then the house has been full. I mean, we have people that are sick for other reasons. And so our capacity has easily been over 115, 120% most days for the last month and a half. So we have a workforce that's, we essentially have three kinds of hospitals. We have our COVID area, we have our general patient population, and then we're doing hospital home or remote patient monitoring, which is an innovative approach we've taken to ensure that there are beds available for our most sick patients. And then we monitor others from home that aren't as sick. And that's the only way we can ensure we have bed availability. But I'm going to pause there. I want to introduce Drs. Ronan and Marx. So Dr. Theresa Ronan is a hospitalist at Christus St. Vincent. She also serves as a medical director for quality and leads our clinician-directed performance work. So she tracks the data about our patients, about our workforce, and we share that every other week with our entire workforce. We have our own virtual town hall because we want to be very transparent with our workforce about what we're seeing, hearing, and experiencing so that they know that we're really focusing on their safety. And then Dr. Marx works as a dyad or a partner with Dr. Ronan and really keeps an eye on the data and information that comes out of the CDC, public health orders, et cetera, surrounding states. So it informs our decision-making in terms of the kinds of care we provide patients, as well as the care we provide of our associates in this particular environment. 3 times a week, we have a clinician team that gets together for about a half an hour to talk about all that stuff. And these 2 individuals lead that 3 times a week conversation so that we are always making modifications internally that respond to what we're hearing. So it may impact our visitor policy, it may impact our vaccination policy, our quarantine policy, et cetera. So these are the folks that are the right persons to talk to. I'll begin with Dr. Ronan, and I'm sure most people are asking, is Omicron in this, are we seeing it in Santa Fe? How is it impacting numbers? So I'll start with Dr. Ronan to sort of give her assessment of what the last couple of weeks has looked like.
Absolutely. Thank you, Lillian, for that nice introduction. Hello, everybody. I'm so glad to be here with you all today. So we do know that Omicron is in the state of New Mexico, but how wildly it's influencing our numbers and our rates of COVID-19 in our community is not yet well known. It's here in New Mexico, but is it responsible for our most recent spikes? I don't think so. I think Delta variant is still predominantly what we are seeing at our hospital. We have had a significant increase in the number of patients that we are seeing, and that may be in large part due to holiday celebrations, et cetera. So, one of my messages to the community is really what we've known about COVID for so long, mask wearing, social distancing, and vaccination. These methods really do work, and we do have some data at the hospital to support that vaccinations really work in what we're seeing in our COVID-19 unit. And I'd like to share that with you all right now, actually. So, as Lillian mentioned, 80% of the patients that are admitted to our hospital are unvaccinated. And unvaccinated means they haven't received their 2 doses of vaccine or their 1 of J&J. And that actually not only translates into hospital admissions, but it's whether or not they are of critical care status, so super sick. And those that are vaccinated are far less likely to pass away from COVID-19. So really, I encourage you all, if you haven't been vaccinated yet, to do so. And I think the vaccine is going to be more and more important as Omicron, we know it's coming to New Mexico. We know it's here, and it's going to spread rapidly, I anticipate, in the next several weeks to months. And the best method to prevent and keep yourself and your family safe is to really get vaccinated.
Thank you, Dr. Ronan. So I had family that came in from out of town. My 2 kids are here for the first time together at the same time, and they're all fully vaccinated, which is wonderful. But now they're going to head home. And so they want to make sure they just get an over-the-counter test, an antigen test, to make sure that when they get to where they're going next, they're super safe. And those are hard to come by. those are hard to come by. So I'm very appreciative that they are fully vaccinated and asymptomatic. But it comes to the next question for Dr. Marx, because we're seeing a lot of some modifications to CDC guidelines and recommendations, testing availability. Do you want to speak to what that means for us and our community, James?
Sure, and thank you for inviting me to speak today. First, I'll say that the testing methods that we used at Christus St. Vincent, the PCR test, is capable of picking up all the variants. So we are not having any challenges with picking up variants with our testing. We currently have a testing center that's operated Monday through Friday. That is by appointment and by physician referral only. It's not just a mass testing site for the public. There are those that are available, but Christus St. Vincent is only doing people who are having symptoms and that have a physician referral. So as far as testing goes, we're good with our supplies. We are testing roughly about 40 to 50 people through our emergency room every day, and about 80 to 90 at our outpatient or at the remote site for testing. In addition, we have our vaccination clinic that operates on Wednesdays and Thursdays, and that is available by appointment only for everyone who is 12 and older. We are also offering pediatric doses at our pediatric clinics, and that is done by appointment in a pediatric clinic. We had some mass vaccination events for pediatric patients 5 to 11, and it was very well attended. But right now we're going to be able to make it available through the pediatric clinics by appointment.
And so folks call 505-913-3080 to get scheduled. How effective are those antigen tests that you can buy at any of the local places, James?
So antigen testing is really intended for people who are having symptoms or for repeat testing of someone. So the schools, for example, are using antigen testing because they're testing students and teachers on a frequent basis. But a one-time antigen test has some false negatives. So when you buy those kits at the pharmacy, it comes with 2 tests, and you should do both tests within the time period that they recommend, because of the possible of a false negative test. So follow the directions. If you do buy those home tests, I know they've been difficult to find. But home testing, I think we're going to see more of those. I know the federal government is talking about distribution of those home tests. And again, those are antigen tests, and they do have some limitations on whether or not whether or not they're completely accurate. If you're having symptoms, you should get tested with a PCR and contact your healthcare provider to make those arrangements.
Dr. Ronan, you want to speak to how this second year of this darn pandemic is different than our first year experience, because the patient demographics are slightly different. Those how they react and respond to care is different. You want to sort of give it a high level?
Yeah, absolutely. So I think there's a lot of things and a lot of energy in the community about the vaccine. People are very either for or against it. And we are now seeing a lot of patients in the hospital that have been against the vaccine. And some of that frustration comes out toward our medical staff. And so we have a wonderful healthcare team, but they have been working tirelessly now for well over a year, and putting their all into taking care of the patients of our community. And so when some of this frustration is deflected onto them, it makes serving and the desire to serve sometimes challenging. But again, I think our healthcare team, they're strong, they're in it, they are there to do the best for our community, but we are kind of experiencing some of the brunt of some frustrations that have been going on for many months.
There's a real weariness. I mean, it's been a long 21 months already. I know in the first year, a great majority of our patients that experienced COVID were much older. right? And then this round, we're really
Yes.
just caring for patients that are mostly unvaccinated, and the age range is wide, correct?
Yes, the age range is quite wide, but we are now seeing a younger population of patients. It's well known that the older generation of individuals are more likely to become vaccinated, and the younger generations are choosing not to be vaccinated. So we're seeing a much younger demographic, which is also very challenging for healthcare staff to see younger patients passing away from something that it could potentially be prevented with a vaccine.
That's probably one of my big takeaways from the last 3 weeks is the emotional toll it's taking on our team that's caring for patients in Frost. There was a period there, I think, of 3 days where we actually lost 6 patients in 3 days that were far too young, and they're still carrying that emotional toll. And it's not for us. We just got to love on them, but it is particularly challenging. James, Dr. Marx, one of the latest CDC guidelines is around quarantine periods. What do you want to speak to that change?
Sure. So that was released just last week, and it first came out just for healthcare workers, and then it was extended out to the general population for the quarantine of a minimum of 5 days. Here in the hospital, we are having staffing challenges, and this was done in response to where the science is about infection period being up to 5 days. So we are evaluating using that as a tool to help get our workforce back for people who are asymptomatic, people who tested positive and are not having symptoms. Are they safe to return to work? So we're in the process of implementing using that tool to help make sure that we have enough in our workforce. We saw many people positive just yesterday in our workforce, but they're not getting COVID from work. Matter of fact, it's pretty clear they're getting it from the community and from their interactions with socialization and being in gatherings. So we have not had a case of COVID of a staff member getting COVID in our COVID unit for well over a year and a half, I think,
Right.
before the vaccine was even out. As far as vaccine goes, I wanted to say that, Christus St. Vincent was the first hospital in New Mexico to receive the vaccine last December, and we started vaccinating our staff. And we've then expanded out to the community. But among our staff, we had 88% of our workforce get vaccinated prior to the governor's public health order in August, which required healthcare workers to get vaccinated or have a medical or religious exemption. And our vaccination rate went up to 95%. And now the public health order is requiring boosters. So we are challenged with making sure that our entire workforce is boosted. And so by January the 17th, we will probably have close to 95% of our staff being boosted. So 3 vaccinations, so that we are able to protect the workforce and as well as protect patients while they're come here to the hospital.
Well, and I remind people that probably the safest places in the entire community are hospitals and clinics, because that's our focus is on safety and quality of care. So, and I think that is one big reason why we are bursting at the seams with non-COVID patients as well. We have individuals who, for many reasons, have either delayed care or the length of the pandemic has caused issues that are different. And so we are seeing greater numbers of patients. We are seeing higher volumes of non-COVID patients than we saw pre-pandemic. So it is incredible the compliment that this team is feeling from patients choosing to get their care here. And our team is doing its level best to honor that commitment in spite of some staffing challenges, in spite of being in a pandemic. They are here to serve, and they are incredible. Mayor, I've monopolized your call. Do you have any questions?
I do. There is one question. I don't know. I don't know if you all have an answer for it, but it's an intriguing puzzle. We have a very high vaccination rate in Santa Fe County, both first first vaccinations and then second and then third. And we still see what used to be called breakthrough cases. So it is safe to say that it's the right thing to do. We're not pointing fingers for people who don't choose to do it, but it's the safest course. But there is no guarantee with this particular pandemic that even vaccinations will prevent any kind of an infection from happening. We've got to do all of the above: vaccinations, boosters, masks, smart social distancing, hand washing, and look after each other. Testing as well. You touched on that. So we really are trying to cover all of the bases to do our best to keep people safe and help people keep their families safe. Is that a fair? That's an essay question for anybody who wants to take a shot at it.
Well, we are caring for not only the community, but we also care for the greater New Mexico area. We get transfers in from hospitals that have reached capacity, and we take care of them not only in the COVID unit, but also trauma patients and other referrals from outlying hospitals. So our hospital supports all of New Mexico, and we've had transfers from out of state, especially at the beginning of the pandemic. We got so many transfers from the Navajo Nation. That's really what filled up our COVID unit. And this was May in 2020 was when we really saw a lot of transfers. So the hospital not only serves the Santa Fe community, but also the greater New Mexico.
Well, I'm grateful to all of you. And Lillian, thank you for bringing your team with you and for your participation today. And we may do this again. Let's hope the numbers don't spike. We know they could. I'm going to try to summarize a few of the things I've heard, and then we'll sign off. And we can come back again. As I said, this is incredibly useful. This COVID pandemic is an evolving situation. As you described it within the hospital, it's an evolving situation. You're constantly evaluating the data, the science, the public policy, and the health policy to try to make informed decisions. It does seem clear that the numbers have gone up. I'm reading some notes here. Monday, health officials reported over 3,000 new cases for the 4-day Christmas holiday for New Mexico, with Santa Fe County numbering the third highest cases, and 87507 ranking 8th in the state for most new cases. As you all said, being unvaccinated certainly makes you more at risk. And so we have information we didn't have in 2020 about vaccination rates, booster rates, the benefit of mask wearing, of social distancing. We've even seen some of our venues, some of our favorite venues in town, like the Lensic, saying if you want to come to an event, bring your vaccination card. That kind of practice can be another way to reduce spread and give people confidence that at least the people around them are vaccinated and wearing masks indoors. We have New Year's Eve coming up. We'll be doing it on the plaza. If you're not vaccinated, think twice about coming out. It's a personal choice, but you may expose yourself to being around a lot of other people, and it's a risk you don't want to take. If you are vaccinated and boosted, whatever the verb is, you're still somewhat at risk. The data say that. Wear a mask, practice social distancing. Being indoors continues to be a more risky situation than being out of doors. If you are not feeling well, get tested one way or another. If you're around somebody who has tested positive, it'd be a good reason to get a test yourself. If you're not yet vaccinated, we heard the number. Why don't you give it to us again to make an appointment? If you want to get vaccinated or a booster, what do you do, Lillian?
Call 505-913-3080.
And the city of Santa Fe, if you're 18 years or older, we're having a vaccination for Moderna vaccine tomorrow at the Public Safety Building at the Midtown site between 10 a.m. and 3 p.m. It doesn't matter which vaccine you've had previously, you can still get the Moderna now, I'm told. Dr. Marx, everybody is shaking their head. That's true. Walk-ups, you can you can register at the DOH website, but we will still honor people who walk up, who say, I need a vaccination. We will get you vaccinated. And one last word before we sign off. It's safe to say that not only have the people at Christus and our other major medical providers, clinics, hospitals done an amazing job for the last 20 months, our community has done an amazing job. Santa Fe, northern New Mexico, our people are really very, very courageous. They're considerate, they're thoughtful. They understand the severity of this pandemic, and all of us have been working hard to take care of each other. The numbers are amazing. In Santa Fe County, 99% of people 18 years and older have had at least one dose, and 85, almost 86% are fully vaccinated. That's a great record. That's an amazing record. We still see people wearing masks everywhere they go because it's a sign of respect and concern for your neighbors and your family. Let's stay vigilant. Let's be aware that Omicron and other things will continue to change this pandemic, and we are all in it together. We need to take care of each other. We've got amazing healthcare providers. It's not just your physical health, it's your mental health. This is a stressful time. If you need help, get mental health as well as physical health. Take care of each other. Take care of your families. Take care of our community. Use good common sense when it comes to this current spike and potential spike that we've seen in other parts of the country. I'm so grateful to Lillian, you and your whole team, to everybody in our community who is on the front line, nurses, doctors, emergency personnel, our police and fire people, EMTs, you name it, teachers, everybody is really standing together, standing strong, standing proud. It's an amazing performance of courage and compassion. We are fully aware that the situation may be about to change. Let's do our best to keep it from spreading, go back to the things we did, to be very careful and very considerate and very community-minded. We can really make a big difference for each other. Thanks to everybody on the call. It's such a great joy to have you to go to for advice and for counsel and for wisdom. And to everybody's listening, please share this message with your family, with your coworkers. Let's have a safe New Year's and go into 2022 safe and together, taking care of each other. Thanks, everybody. I'm very grateful to you. Thank you.